Piotr Kulakowski, Warsaw, Poland. I have a question to the study after ablation. Because we electrophysiologists pay attention to AF recurrences. We know about hypertension, but we don't have time usually to ask patients. So do you have the data on the values of blood pressure after ablation, and is a correlation between blood pressure and recurrences?
Thank you for a great question. So, yeah, unfortunately, I haven't had that, but I'm still analyzing that data between the daily blood pressure data between and the atrial fibrillation recurrence. Thank you so much.
What was the acceptance of the patients in the large cohort that you introduced of the 4,000 patients that you are currently analyzing? What is the compliance if you equip the patients with such technologies? Is it well accepted?
Yeah, it's also a good question. So all of the people are willing to do the super at-home EKG and the blood pressure, because in Japan there are lots of people having the blood pressure measurement in their home at home. So that's why they are very easy to get used to that. Yeah. So, but some of them, they look at the data. For example, some of them look at the data about the possible atrial fibrillation, but they don't do anything after looking at the possible atrial fibrillation. Yeah. So I don't have a symptom. So why should I go to the clinic? So what should I do? So some kind of the situation had happened to our research. So that's a problem, I think. So we need to consider about those kind of the situation. So that new relationship between the physician and the patients.
Yeah. I personally believe that this area of hospital at home, healthcare taking at home, will become significant in the years to come, as it's a technology that will help us to cope with the increasing number of patients that that is impossible to be treated in the traditional healthcare system. The healthcare systems are overloaded, even in Central Europe and in Japan. And one of the quality improvers and by the same time bailouts is hospital at home applications, so home care. What is Dr. Osman, what is your perspective in UK? What are the main roadblocks for implementation? I mean, the technologies are there, the data are there. Why are we so reluctant to implement that on a large scale?
Thank you. Thank you. So it's a very good question. As with most things in life, money is important. These technologies, of course, aren't entirely cheap. But I think if you can show cost effectiveness, then they're important. The one thing we learned from our study was that patients given devices, you can't just give patients devices and leave them to it. You have to have some sort of solid framework of support. A number of our patient groups and those that were public volunteers, they took tracings, and several of them saw funny things because there was a lot of artifact, and then they panicked and worried. Luckily, they had research nurses they were able to call who download and send the tracings. But if we're then expanding that onto a big mega stage, we need to make sure we have the support infrastructure in place so that patients can contact arrhythmia nurses or whoever it might be, their healthcare physicians or nurses, to then be able to perhaps interpret what is being seen. But you're right, the evidence is very strong, and I'm sure over the next 5-10 years these technologies will be taken. The one question I was just going to ask Professor Senoo, out of the 15 patients, 2 of our patients didn't return the complete device. Because obviously it's a big shining device, we weren't able to get the devices back off them. In your study, you had over a lot of patients. Did you lose any of these devices? Did you get them all back?
Is a ablation study or
either one?
Okay. Yeah, that's a good question. Only one patient couldn't get back that blood pressure for us.
See, that tells you about the population of Japan compared to Coventry, perhaps.
We are eager to chase all of them. Yeah.
We tried chasing hard as well.
Yeah.
But the patients weren't responding at all, not picking their phone up.
Yeah, I believe that it's also a huge educational task to open up the mindsets of citizens and patients to go into the direction of self-monitoring and self-diagnostics. It will be one of the key developments in the healthcare sector, particularly in cardiovascular, self-monitoring, self-diagnostics, and it will enable the patients also to cover a different role in their own healthcare and healing processes. It needs to get along with educational programs, so it's kind of part of a holistic strategy. At the end, it will deload the traditional healthcare system, it will improve the quality of care, it will reduce complications, and it will also reduce costs. If there are no further questions, we would like to thank Omron Health, the sponsor of the Satellite Symposium, for making all this possible. I thank our two presenters for superb presentations. I thank you. We thank all of you for your interest in the topics that we discussed over the last 45 minutes, and we wish all of you a further fruitful and enjoyable Congress here in the beautiful city of Amsterdam. Thank you. Take care.